Your health is important to you around the clock. That's why Catholic Health Services now offers MyChart, a web-based application that provides patients with instant and secure access to their medical records from the comfort of their home. So what does that mean for you as a patient? What information can you access, and what are the benefits? As we move into the electronic age of medical records, stay with us for all the information you need to know on today's episode of CHS Presents Lifestyles at the Heart of Health. Hello, everyone. Thanks so much for joining us. I'm Jane Hansen. A growing number of hospitals nationwide are improving quality and efficiency by going electronic. All 6 Catholic Health Service hospitals and a number of physicians' offices have launched a system where you can access your own records through CHS's MyChart. What are the benefits of this technology? What does it mean for you as a patient? Here to help answer all those questions and so much more is Dr. Alan Katz, the Director of Cardiac Imaging and Informatics at St. Francis Hospital and the VP of Medical Informatics for Catholic Health Services. Welcome. Good to have you here.
Thank you very much, Jane. I'm glad to be here.
That giant title means that basically you're the guy that from the medical side of things helped implement all of this electronic medical records.
That's right. It's my responsibility to be involved in the medical aspects of bringing the electronic healthcare record live and implementing it to its fullest.
So what do we mean by that phrase, electronic medical records?
So the electronic medical record is a way of keeping patient information in computer-readable form. And some of the advantage of the electronic healthcare record is that it can be visible to multiple doctors at multiple locations securely. It can be updated and it can be used in the hospitals. It can also be seen in the practices of those doctors who use the medical record. And again, it's securely stored information.
I would assume that that's one of people's biggest concerns is how safe is this information? So that probably had to be the biggest thing you had to put your arms around.
So all of our hospitals and all of our practices have to go through a HIPAA privacy audit at least once a year to make sure that they have all security in place, and there's no reason why anyone who shouldn't get a hold of the information will get a hold of the information.
One of the things that strikes me is that the old-fashioned medical charts where, doctors and nurses, everybody wrote in it, sometimes there could have been misinformation because things weren't legible.
Exactly right. And believe me, the big impetus behind the electronic healthcare record is to improve medical care. And one of the ways in which we do that is we're no longer looking at chicken scratching and some questions about what's written there. Everything is clear, it's all entered electronically, and it can be seen by those doctors who appropriately are taking care of the patient.
So if I'm a patient, I actually can access this MyChart from my home.
You can.
And how does that work?
So the way it works is first you have to have a relationship with Catholic Health Services. You need to have been seen in one of the hospitals or one of the practices that uses our electronic healthcare record. And then you're offered the ability to open up a MyChart account where you will be able to either on your computer, on your telephone, on your iPad, be able to take a look at your electronic healthcare information. The information that's there includes your problem list, medications, allergies, test results, and a summary of the medical history.
Wow. So if you, let's go say you're going to go see a new doctor, that means that when you get into that doctor's office, filling out that old chart at the beginning, don't have to do it?
Absolutely. If you are at a CHS hospital using our EHR, you automatically get to see what was there before. And in fact, our EHR is open enough where we can transmit information to other electronic healthcare records with the patient's consent and with the patient's thoughts.
So I mean, what you just said about with the patient's consent. So let's say that you've got maybe a team of doctors working with you on some medical issue. Does that mean that everybody on that team can automatically get in and look at your records, or does there have to be some way of absolutely saying this is who can see it and who can't? I mean, how do you make sure that's in place?
So if you're credentialed at CHS and you're taking care of the patient, you're welcome to look at that information. And we have not blocked it off to everyone because the concern is that if there's an emergency, if there's a doctor who hasn't explicitly been given that permission, they may not be able to see that healthcare record. But we do audit to make sure that appropriate people are looking at the charts of patients that they're taking care of.
Was it challenging to get this in place? Because I can see all kinds of obstacles.
It was challenging. It was challenging in a couple of different ways. First of all, it's a different workflow for the physicians. The physicians were used to documenting in a very different way. Second of all, it was a concern for the patients because when their doctors are sitting there sometimes using the computer while they're talking, they're wondering, gee, is the doctor listening to me? Does the doctor understand? And most of the doctors understand that concern as well. And so they may document outside the patient, or they'll make sure that they look at the patient and talk with them.
So that means the doctor has to physically enter the information now versus what they might write in a chart or something?
That's right.
That's right. And what about the ethical considerations of all of it? Because I know how in the medical world there's always teams of people that are saying, let's make sure that from an ethical and Hippocratic oath kind of thing that we're doing the best thing for the patient. How did you deal with all of that?
So we do think we're doing the best thing for the patient because the best thing for the patient is to have all accurate information at the time that you're making a clinical decision. And that's what we provide, is we want to make sure that you can have every information. The patient, we don't want to delay care also. So sometimes the patient will go to another office and have a procedure, and that procedure result may not follow them to the next doctor. This way, that doctor can see that information, can interpret it, and use that information in the treatment plan going forward.
The one other question I really have is, when it comes to who can enter the information, does a patient have an ability to enter information from their home?
So the patients will have ability to enter some information from their home, and that is before they see a doctor, or maybe after they've seen a doctor and something came up, we can send them an electronic questionnaire so that rather than sitting in the waiting room writing it out, they can do that from their home, send it to their doctor electronically, again securely, and then the physician goes over it with the patient or the medical assistant and makes sure that it's correct and brings it into the electronic chart.
But I mean, it's not like a patient could go in and add things about prescriptions or about any of that sort of thing.
No, we want to make sure that the integrity of the electronic healthcare record is maintained. And those people who appropriately can enter information. So there are some things that we do want the patient to enter, such as the questionnaire. There are things we want the medical assistant to be allowed to do, like past history, past family history. And there are other things that we just want the physician, mid-level practitioner, or a nurse to do. So we've delegated those responsibilities to make sure that the appropriate person documents that information.
So overall, since you've watched this kind of baby give birth with the electronic records, and in terms of how you feel it's going, is it going well? Are you happy with it? Do you think there needs to be improvements? I mean, do you think that it's really going to make a huge difference?
I'm very happy at the way it's going. When we started doing this over 2 years ago, really close to 3 years ago, we had to do a build. We went with the largest electronic healthcare record company in the United States, Epic. And Epic suggests that you do basically an 8 to 9 month build before you even go live. So we brought physicians together, we brought nurses together, we brought pharmacists together to make decisions as to how it was going to work. That process went well. At our first go live, I was a little bit concerned, and actually before it, because one of the things Epic says is that the physicians have to train for a certain amount of time in classroom. And I thought, are they going to do that? But they did.
Did they really?
And when we went live at our first hospital, St. Catherine's, there were physicians who were skeptical who actually came over to me and to Marcy Dunn, the CIO, and thanked us for going with the electronic healthcare record. So I'm very happy with the way everybody, and it really is a joint effort, not only the clinical staff, but the financial staff and everybody being involved in bringing this live. And we're going to continue to improve it.
And I'm sure that over time it will make life easier.
It has already, and it will continue to do that. Just as one point, we're treating populations now. We want to make sure that we give the best care to the patient, the most appropriate care at the right time.
Thank you very much,
My
Dr.
pleasure.
Alan Katz. Wonderful to
you.
speak with you. So now we have to take a quick break, but stay with us as we take you step by step with MyChart when we return with more lifestyles. Welcome back to CHS Presents Lifestyles at the Heart of Health. New developments such as MyChart, offered by Catholic Health Services of Long Island, aims to make patients more active in their own health care and provides access to doctors and your comprehensive health history just by logging on to a secure computer or any privacy-protected internet-accessible device. Well, some people may be comfortable with these new technologies. Others could be intimidated at first. Joining me now to discuss this system and more to make you comfortable is Jean Egan from St. Francis Hospital. Thank you, Jean, for being here.
Pleasure to be here, Jane.
So you were the person who rolled out or helped roll out this whole thing of MyChart. So the reaction to it at the beginning as compared to now, how's it going?
We've made significant track records and implementing MyChart across the health system. Right now, many of our facilities have 30 to 40% enrollment of patients in MyChart, which is terrific from an engagement perspective, especially when they go on for additional care.
Mm-hmm. And you're hoping to obviously bring that percentage
Absolutely.
up, but it's all a matter of getting people informed. So tell me exactly, give me kind of the dynamics of how it works.
So a patient actually is educated in the hospital where they're provided information about MyChart by a nurse or a staff member, and they go through enrolling in it and they test signing into MyChart, and then they receive information when they're going home how to get back in. So their education and enrollment occurs first at the hospital. And then if for some reason we miss a patient, then they also receive information so when they go home to be able to sign in.
So does that mean that every single person going forward that is hospitalized at one of the hospitals in the Catholic Health Services system, that they will have an opportunity to enroll?
That's our ultimate goal, Jane. We actually enroll them at the hospital as well as our practices and our ambulatory centers.
What's the most frequent question they ask you?
It varies what they ask, what's the purpose of this. As you can imagine, when a patient is in the hospital or at another care facility, there's a lot of information they're exposed to. So they obviously ask what's the benefit to them. Mm-hmm. And once they see what's on the site, we've gotten a lot of excellent feedback from our patients as to how this is great, or areas where we can continue to improve our site.
So it's a work in progress.
It's a work in progress.
Now, is there, when you talk about a mobile device, is there an app or something of that sort? I mean, is this a service that has to be paid for?
So the first time they log in, they have to use a desktop to do so, but they're able to use their Android or their iPhone to sign on any subsequent time. So there is an app for MyChart that they could sign into and access the same information.
The medical records that are on there, are those the medical records then? I mean, are they long-term medical records? Are they medical records from somebody's way in the past? Can those be inserted in there as well or not?
So some of the information goes back historically from our hospitals, if they were seen there, and the rest is new information. So it's a combination of both.
And so does that mean that anytime going forward then, once somebody's enrolled, if they go to see a physician that's in the system, or they go back to the hospital, or they go to another one of your centers for some reason, all of that information can then be automatically entered in? It's kind of the process?
Consider it almost as a hub or a center of information, and it's a one-time enrollment that they do, and it is for any of our hospitals and health centers.
Is it interactive? Meaning, now let's say I'm a patient, I go home from the hospital and I've got a question of a nurse or a doctor. Can I ask that through the system?
So there is functionality to send electronic messages to physicians and other care providers. And it's limited to certain types of messages, but they can request refills, they can request information follow-up for their visit.
And can they ask for a phone call, something like that?
They can also request to set up a subsequent office visit as well, and then a staff member calls them back. Right now, our patients can't actively enroll themselves in it, but they can request an appointment.
And when they ask, I'm sure that big question, I mean, I already discussed it earlier with Dr. Katz, that big question about, is it secure? Is it safe? Is that really heavy on their minds?
We've heard it from time to time. I wouldn't say we've been approached a lot about the security of the information.
Are there new, I mean, will there be new developments as you go forward? Is it like, are you constantly adding to it?
So we're constantly looking to see if, for example, our patients have asked to be able to schedule themselves for their office visits, to be able to access additional information that occurred during their visit. So we're constantly looking to see how can we improve it and add more information that's more meaningful to them.
What about a patient that might not be very computer savvy, maybe somebody who's older, who would like to be able to have this kind of central, you can see the benefit of and the efficiency of it, but yet they don't really know how to do it. Can another family member actually have access or be their proxy?
So we have a process where they can appoint a proxy in their place to have access to MyChart. It could be one and the same as the individual named as a healthcare proxy to make their care decisions, but it could be somebody else. So they can request that, have the form filled out, and then that individual can serve in that capacity and would have access to that information for them.
And then how about downloading, printing out? Can you send any of this information to the insurance companies? I mean, how does all of that work?
So a patient has an ability in there, it's called a Lucy record, but basically it is the ability to download information electronically, so if they go elsewhere, they can bring it with them, either on a flash drive or print it out. So almost all of the fields in the MyChart is enabled for printout.
And so that would mean if somebody's going to, say, a certain specialist that maybe there isn't one in the neighborhood or the system, and so they can go someplace else and physically take this with them with a little...
So what we've
thumb
seen
drive?
as our patients using most is if their physician is not on the same product as us, as Dr. Katz mentioned, Epic, and they would bring that copies or the electronic version on a flash drive with them.
But that would sure make it easier than carrying those whole big files with you places. Sounds interesting. Well, we're going to take a quick break and have further discussion, but don't go anywhere because there is more. CHS presents Lifestyles at the Heart of Health right after this. Welcome back to CHS Presents Lifestyles at the Heart of Health. As we wrap up our discussion today, I want to thank both Dr. Alan Katz and Jean Egan for helping us feel comfortable about this whole new system, MyChart. I know we talked about patients' reactions, but it would seem to me that it's much easier to be able to go home and absorb information after you've been to see a doctor. Is that another advantage?
Absolutely, Jane. I can tell you that there are studies that show that patients only remember about a third of what their physician tells them when they come to the office. And this way they can go back, they can look at it, they can understand what the tests were that were ordered. So we really do want to engage patients in their health, and it's the best way to take care of patients.
And don't you think, Jean, that going forward, I mean, this is the way the world is. So it's either get on board or...
It is an industry trend, and all facilities are moving towards implementing if they haven't done so already. And it makes it easier for the patient rather than having to request multiple times paper-based copies to be able to share that either as the download or hard copy at the office, or even showing their provider an iPhone as to their results.
Do you guys think that it will help with mistakes, help prevent mistakes too, in terms of dosages or medication or et cetera?
Absolutely, because sometimes patients don't remember what medication they're on, they may not know what the correct dose is, and sometimes physicians aren't aware of some of the problems that they have in some of the other medications. This is a great way to have continuity of care as you transition from one physician to another, as you transition from going in and out of the hospital.
So it's all to the patient's best benefit.
Absolutely, that's the most important thing.
All right, thank you both so much for being here today. We really appreciate it. And as always, for more information or to schedule an appointment with Catholic Health Services of Long Island, you can call 1-855-CHS-4500 or visit chsli.org. Thank you so much for joining us today. We hope to see you logged on soon at mychart.chsli.org. I'm Jane Hanson, wishing you goodbye and good health.